I would like to start asking you, Pei. So is there any testing that you think should be done from a pathological standpoint beyond what I mentioned here for patients who's looking for a CAR T-cell therapy?
Sure. So as we discussed in the last case, we should perform FISH using a panel on this patient again to see if there's a high-risk FISH abnormality such as deletion 17p. And also we in our institution, we perform NGS to look for mutation of RAS mutations as well as mutation of the P53 gene. As Dr. Chari mentioned earlier, the mutation could render the P53 deletion either now it could be biallelic instead of a monoallelic. And for the patient who has considered for the CAR T therapy, there's flow cytometry studies that can be done using the antibody against the BCMA to detect the expression level on the plasma cells or the neoplastic plasma cells. So these tests can be performed and to help further characterize those malignant cells.
I wanted to ask you, in the eligibility criteria initially for this study, for the phase 1 part, they required 50% or higher BCMA expression. But as the study went on, this was amended, and I believe this was removed from the eligibility criteria.
Right.
So how could that be, and could you comment a little bit on BCMA testing for the purpose of CAR T-cell?
The BCMA testing, the NIH actually does it. Dr. Mary Alice Stella Stevenson has some data. We are still getting the data in as we talk. But the main thing is that we have noticed that not many patients actually have very high level expression. Whether those patients will respond to therapy, we don't really know. It's like a CD30, right? The expression level may correlate, but it's not a complete, absolute correlation in terms of using the antibody against the particular target. So in terms of the cutoff of whether 50% is necessary or not, I don't think there's a clear answer. The jury is still out.
And I do
It
think
seems like in preliminary work that there's a lot of variability in BCMA testing as well,
Exactly.
right? In terms of the antibody quality. So
antibody quality,
Yeah.
right. So the data is still coming. So
and that the new clinical trials targeting BCMA, the CAR T cells, they don't require BCMA testing at all. And I think there is data from several groups, our group, UPenn group, and other groups saying that if you look in patients carefully, you will see BCMA expression in every patient. And it may be low in some, but at least there is some. And many of these emerging studies, as you indicate, suggest that even with lower expression levels, you have a very strong efficacy from these therapies. So the jury is probably out still to see how the correlation goes, maybe for duration of the responses and things. We don't really know that.